Hello everyone, good morning all. Today let us discuss one more topic under biochemistry, that is hypoglycemia. Let us see the objectives of the today's presentation. The objectives are we have to know regarding what is hypoglycemia and causes of hypoglycemia and what are the symptoms we can identify patient with hypoglycemia. And finally, we need to discuss regarding management or treatment of hypoglycemia. Hypoglycemia. Hypoglycemia refers to low level of sugar or glucose in the blood. Hypo. What is the meaning of hypo? It is a decreasing. What is going to decreasing? Glycemic level. Emia. Emia means blood. So there is a decreasing of glycemic levels in the blood that is known as hypoglycemia. Hypoglycemia, it is not a disease, but it can indicate a health problem. Hypoglycemia is a fall in blood sugar levels to below normal. We can notify the structure of pancreas. Pancreas will be helpful for the maintenance of the blood glucose level. There are two kind of hormones in the blood. One is insulin, other one is glucagon. So insulin will be helpful for the reducing of the blood glucose level, whereas glucagon will be helpful for the increasing of the blood glucose level. In certain cases, the patient blood glucose level follow below the normal ranges. Then let us see the normal blood glucose levels. So the fasting blood glucose test a level between 70 and 100 milligram per deciliter. It is considered as normal fasting. What do you mean by fasting? The blood glucose test we are monitoring at morning time, especially around 6:30 to 7 a.m. We are going to measuring the patient blood glucose level in fasting condition. Fasting means patient is not eating anything from the morning. In that condition, we are going to be monitoring their blood glucose level, that is considered as a fasting blood glucose level. This fasting blood glucose level, the range is between 70 and 100 milligram per deciliter. There is another investigation that is known as random blood glucose level or RBS. It's a normal result depends on when we last ate. So random, what is the meaning of this random? Random means within a day, any time we can measure the patient blood glucose level. Most of the time, the blood glucose level will be 125 milligram per deciliter or lower. So in the whenever we are checking the patient blood glucose level in random condition, random means within 24 hours, any time we can consider or any time we can check the patient blood glucose level. The range is between the normal range is between 125 milligram per deciliter or it should be lower. Then let us talk about the causes of hypoglycemia. The causes of hypoglycemia include use of drugs. So what kind of drugs? If the patient is diagnosed under diabetes, he is supposed to be, if the especially type 1 condition, he is supposed to use the insulin. So in that insulin, sometimes the patient is unable to consider this insulin properly and certain kind of liver diseases and tumors that releases the excess amount of the insulin. So once this excess amount of the insulin will be there, that is it, that will become this excess amount of insulin will be reducing the blood glucose level more. And other cause may be pre-diabetes. So what do you mean with pre-diabetes? Pre-diabetes, it's a serious health condition where blood sugar levels are higher than the normal. We have discussed regarding fasting blood glucose level. This fasting blood glucose level, the patient has to manage 70 to 100 or 70 to 110 milligram per deciliter. But in once the patient is in the state of pre-diabetic condition, pre means prior occurrence of the disease condition, patient may be explore some kind of symptoms relevant to the blood diabetes mellitus. It's a serious health condition where blood sugar levels are higher than normal, not enough yet to be diagnosed as a diabetes mellitus. That is known as pre-diabetes. Then in sometimes Symptoms of hypoglycemia occur after meals, that is known as reactive hypoglycemia. Generally, after when we eat any food, our blood glucose level has to be raised. Certain cases, what will happen? It will not raising the patient blood glucose level. After eating also, the patient blood glucose level showing as a very low. So that is considered as a reactive hypoglycemia. This is differ from low blood sugar, that is hypoglycemia, that occurs while fasting. So whereas when we are in the fasting condition, there is a falling of the our blood glucose levels. However, at another type of hypoglycemia is who are either on insulin, drug induced, which occurs in patients of diabetes mellitus who are either on insulin or oral hypoglycemic drugs. For example, patient is considering or patient is receiving regularly insulin therapy, so he is not monitoring his blood glucose level and he was keep on receiving this insulin drugs, that is like insulin injectables or oral hypoglycemic drugs. Injectable means the insulin we are administering to the patient in the manner of or in the route of subcutaneous injection. Oral hypoglycemic drugs are oral medication that is consumed by the patient prior food if he is diabetic patient. Then it is commonly thought that fasting hypoglycemia is a serious condition, whereas reactive hypoglycemia is invariably a benign disorder. So what do you mean by benign condition? It's a type of cancer. The growing tumor may be altering the patient blood glucose levels. Then let us discuss regarding symptoms of hypoglycemia. The hypoglycemia may result in a variety of symptoms which includes feeling of hunger. So usually the patient under diabetes condition, he used to feel frequently hunger. Then tremors or shaky movements. Body movements may be tremors can be notifying, and excessive sweating. The patient will be notifying the excessive perspiration. Sweating will be notifying, and sometimes he may be look like pale face and heart palpitations, then dizziness and weakness and blurred vision. So what do you mean by blurred vision? The vision clarity may be lacking. So these kind of things or these kind of symptoms we can notify from the diabetic patients, especially if the patient is undergoing hypoglycemic state. Then, lack of glucose energy to the brain can cause symptoms ranging from headache, mild confusion, and loss of consciousness, seizure, and coma. Sometimes you can see lack of glucose energy to the brain. Our brain is not receiving any energy in the manner of glucose, which can be result from patient may be notifying as a headache, confusion may be notifying, and loss of consciousness. His conscious level will be, so I think you might understand regarding conscious, semi-conscious, and unconscious. Here, certain till the recovery of the patient will go for the or his conscious level may be decreases. And patient may be undergoing sometimes seizure, involuntary movements, that is no that is can be considered as a seizure and coma. So sometimes permanently, maybe sometime 1 month, 2 months, or 6 months, he may be in the state of coma. And sometimes the coma may be variation from the minutes to the weeks or months or year. And sometimes this severe hypoglycemia can cause death. So for example, patient is undergoing his blood glucose level may be below 30 milligram per deciliter. We are not notifying and we didn't give attention towards the patient. In that cases, patient may go for the death because of the low blood glucose levels. Then let us discuss regarding management. In day-to-day our clinical area, we used to notify different kind of patients with the diabetes. If the patient is undergoing hypoglycemic condition, how we need to manage the patient with the hypoglycemia. So treatment must also be focused at the basic cause. First, we have to analyze what is the cause, why patient blood glucose levels is going to be fall below the normal ranges. Then we have to start for the immediate treatment of severe hypoglycemia. So what is the immediate treatment we can able to provide to the patient? So which consists of administration of large amount of glucose. So what do you mean by glucose? Glucose, dextrose. In the hospital there is a IV fluids. We can choose the best one is 25% of the dextrose. You have to remember in this, once the percentage of the fluids are increasing, the concentration of the glucose content in that fluids are going to be increased. So usually basically we used to notify 5% dextrose and 10% of the dextrose. But in this condition, if the patient is under severe hypoglycemia, what kind of IV fluids we need to provide? That is 25% of the dextrose. Now you can see here, immediate treatment of severe hypoglycemia consists of administration of large amount of glucose and repeating this treatment at intervals if the symptoms persist. And treatment of reactive hypoglycemia involves changing the dietary pattern. So including eating few concentrated sweets and ingesting multiple small meals throughout the day. So we can instruct the patient, he have to reduce the calories and he have to reduce the carbohydrate rich diets from his dietary pattern. And we have to explain to the patient multiple small frequent meals he is going to be consumed because he is to feel frequent hunger. So now we come to the summarize our topic. So let us recapitalize today's topic on hypoglycemia. Hypoglycemia refers to low level of sugar or glucose in the blood. This is known as hypoglycemia. So what is the causes? Use of drugs such as insulin, liver disease, tumor that release excess amount of insulin. So what is the symptoms? What kind of symptoms we can notify from the patient with the hypoglycemia? Feeling of hunger, sweating, maybe pale face, blurred vision, and other symptom maybe patient will be showing like symptoms with the pre-diabetes. Pre-diabetes I have explained you regarding this. Before occurrence of the or before diagnosing of the diabetes, so frequently or constantly patient blood glucose level going to be fluctuate. That is considered as a pre-diabetic state or pre-diabetic condition. So how we need to manage this condition? So we can manage the patient this hypoglycemic condition, administration of large amount of glucose, whereas reactive hypoglycemia involves changing of diet and patient has to undergoing the regular monitoring of his blood glucose level. I hope my dear students you understand the concept of hypoglycemia. Have a nice day and once again we will meet. Thank you.